so much.
Yeah.
This is Sven Økeland. I'm a reporter with VG, which is the largest Norwegian news site. You've been talking to or having conversation with Ola and some of my colleagues, I understand.
I
Can I ask
hear
you?
you not very loud. Maybe microphone could be closer.
Let me check. Better?
Yeah, better. Thank you.
Okay, we will give it a try. I understand you're you're the director of the Revival Institute.
Yeah, and President Emeritus of Ukrainian Medical Association.
Meaning you're a former president, right?
Yeah, yeah. I'm
Yeah,
co-founder and President Emeritus, yes.
okay, okay. So who do you represent when we're talking now? Do you represent the Medical Association or the Revival Institute?
Both, both.
You represent both, so you speak on behalf of both.
Yeah.
Can you say something in general about the effect of war on the Ukrainian population?
Of course, Ukraine has a total war, and many residential buildings are destroyed. Many bomb shelters with children are bombed. Lots of hospitals and maternity hospitals are under attack. So we have lots of victims of this war, and this number rises hundreds and hundreds each day. So it's really a Holocaust, but in action, in life. And we need support from the world, from international, from Western democracies to close the sky and to stop the war, because what is happening now, it moves further and further.
And how has this affected the healthcare system of Ukraine?
First of all, healthcare professionals are killed and wounded during provided medical care. Their places of work, hospitals and maternity hospitals, ambulance cars are shelled and bombed, and many of hospitals are totally destroyed now in Ukraine. And next, the whole supply is stopped because economy of Ukraine is on zero. It doesn't work. Many of importing logistic chains are destroyed. Hospitals had not reserve for war, and now even if they have some money, they can't buy something, especially in the red and orange zone, which is close to battlefields, because their suppliers could not reach there. Their suppliers from Ukraine, they do not have warehouses supplied. So hospitals rely usually on volunteer support. It's some activists from these local regions, but we understand that this supply is fragmented and unsystematic. It cannot work as ordinary supply. So we really need to build a long chains of supplying, and our Ukrainian Medical Association built this humanitarian program called Life Vest 5. It's building 5-day supply for hospitals on front line. Everything that they need to provide medical care for wounded victims for 5 days, because any of this hospital can be just converted to military hospital in an hour. Some bombing, some battle nearby, and they receive 20, 100 of victims. And we speak with insiders of this hospital, and we see that in this case, they will have a reserve just for half or 1 day, not more. Those IV solutions, bandages, antibiotics, some basic things, but they have it for half a day or 1 day, not more. So we want to build these long chains to bring it from European Union and to put there just to have this 5-day reserve.
How is your appeal for medical supplies? Is it succeeding? Are you getting medical supplies into Ukraine in large numbers?
We receive lots of humanitarian aid on the channels of government and on different small humanitarian projects conducted by volunteers. But usually when something comes to government stocks, it's centralized and it's hard to manage how it will be distributed among hospitals. And the second thing, usually it is not those goods that I mentioned. Usually it's some paracetamol, ibuprofen, some cold medicine. So it's not, it's important for acute illnesses, but it's not something for wounded people under bombings and or under attack on battle. Of course, we receive as well things that I mentioned, but it's usually small portions and it's distributed chaotically. So now I speak precisely on frontline hospitals, which are close to fields of battles.
Do you have any idea why your call for medical supplies, emergency supplies, why are they not answered? Why don't you get this kind of equipment?
I can't say that we don't get it. We just go to the second step, because first we created a STING-MD petition. It's an appeal to international medical community and community of biomedical researchers, and it received a huge support. We received science and political action from, I think, more than 20 countries and from more than 100 institutions like hospitals, universities, biomedical companies. So these active people, they came to our network of supporters, and now we discuss with them the next step, this LifeVest 5 program. So we already received some package from Syrian American Medical Association, and there are some discussions with further centers.
Has Norway or any Norwegian hospitals or universities signed your petition?
Sorry, is it normal?
No, has Norway, the country, Norway, our country, have they? Are they among
no,
the?
Not yet. We received an answer from our global call to medical associations. It was that European Association of Medical Specialties, they signed a statement on Russo-Ukrainian war, and Norway Medical Association said that of course they understand the problems of this war, but they would like that Norway physicians be consulted before making some statements. So for us, of course, it's not very active support. It's like vague discussion and uncertainty, something like this.
So you would like some more active support from Norway?
Of course, we would like to have this appeal, STING-MD petition. It comes from understanding that governments and structures above governments, like WHO, like Red Cross, like NATO, like European Union, they do not work in the modern world. Unfortunately, we see that United Nations, many of structures, they just work as a structure of statements. They are concerned, they ask to stop war, but nothing more. NATO, a military structure, and actually this war is because Ukraine wanted to go to NATO. NATO gave us just a petroleum, nothing more. And the sanctions that are made from European Union, from the United States, they are too weak. They do not stop war. So our STINGMD petition appeals to lower structures, to medical associations, to hospitals, to doctors, like physical healthcare professionals, because they have patients. Some of them are influential ones, like senators, deputies, ministers, and from this doctor-patient influence, they can influence higher sanctions, more active. And another step is sanctions that could be risen just from inside of medical community, like stopping PhD programs for Russian and Belarusian students, stopping accepting research articles to journals in Western democracies, stopping participation in Russian and Belarusian congresses, and accepting Russian, Belarusian doctors and speakers to Western congresses. So really we need to show that making a Holocaust day by day is nothing to deal with entrance to civilization. And doctors and researchers, they do not need to wait or ask for their presidents and ministers. They can do it just from inside, just by release this active step. Unfortunately, by now, the STINGMD petition received lots of signs and lots of support by word, but only several associations and biomedical institutions really made this step to close the doors for Russian and Belarusians. So we continue this activity because we can't stop. We have already thousands of victims, and this count rises.
So you think the response to your petition has been rather sort of passive and weak?
Unfortunately, I've in the middle of this campaign, I've got COVID and sore throat. I was lying at 10 days with 39 degrees temperature. So in the middle of this campaign, we had a break. So, but it is our second use of this mechanism. STINGMD petition was used also during Maidan, during protests. And then we saw how it works. One of professors that was close to professor who visited our Congress of Ukrainian Medical Association. This professor gathered nurses and doctors of his clinic. They came to office of United States Senator. They occupied it. And it was the first call of US Senator to Ministry of Foreign Affairs in Ukraine. It was just first week of Maidan protests when healthcare professionals were attacked during providing care on streets. So it was first response and first coming to international agenda. So I hope that this war will also come to agenda of medical societies and hospitals and universities and so on, and we will get this response. It's incoming.
But so far, are you a little disappointed by the response?
I'm enthusiastic. I see that many people, it's hard problem, but many professors are in touch with us and discuss it. So I hope that this will give fruits in nearest days, more and more response. So I told that more than 20 countries are already supporting us, and more than 100 of institutions. So probably Russian propaganda is very active as well, and many countries try to be vague, they try to do not step as an enemy of Russian Federation. I think, unfortunately, many countries make a bet that Ukraine will fall in days, and they will just need to be prepared for new reality and so on. As our ambassador of Ukraine was told in one country, it's called, maybe it's Germany, but it's not official. This ambassador came to minister asking for help, and this minister told that why we need to help in several days, it will be new reality and so on. But you see that it is almost months. Ukraine, a small country, beats the second army of the world, and continues to stand and continues to defend, and the victims from the other side is 5 times bigger than Ukrainian ones. So we're really enthusiastic to win in this war. But it's a question of with what count of victims, and how long Western democracies will just look passively on it, and what we can do to stop the war earlier.
What is you're talking about? You're in desperate need of medical supplies. What is the result of when you don't get it, when you lack this kind of equipment that you've asked for? What is the results? What happens when you lack the equipment?
I had many teleconferences with different associations and different professors. They wanted to support, and we've shown this exact list. And now it is like a pause. They disappear. Probably there are some discussions inside of those institutions and associations. But I see that it's unusual approach from our side, because usually humanitarian aid works as bring us everything you can. So all supplies that are outdated, all medicines are with expiry dates, something unnecessary just packed to humanitarian aid and brought to country. But we say that we don't need anything, and not need a stockpile of huge amounts. We need these small amounts measured, but this is small list that needs to be in hospital to stand these 5 days. And if some part of this list will be absent, then it will be triaging and additional deaths which could be preventable. So we need this small amount, but measured and exact this list. So probably I think that many partners will change their mind, and they will start to look this way, because we need to understand that it is the Third World War. It's not a matter of days, it's already a matter of months, and Putin continues to move further. So really we need European Union and international community as our rear back, as the supply chains which supply hospitals, because Ukrainian economy doesn't work. We are blocked from all sides. We can't export anything because everything we have needs to be used inside to prevent hunger. So really it's a question whether these hospitals will work, with support of international community, or they will just provide some easement or some weakening of pain before death, because triaging will come into force, and only all people that could live, they will triage to people who can live, and people who will die because we have no such supplies.
How long has the list of supplies been out? How long has it been out, the list of supplies you need?
It's out for a week, and we had already around 10 of these teleconferences, and each day today we'll have another 3. So more and more partners started to discuss and to find the reserves and ways to provide it.
But how many supplies have you received, according to this list? I'm not talking about outdated supplies or paracetamol or anything, but how many?
Sorry, I don't hear you.
Yeah. How much concrete response have you had to this list? How many tons of supplies have you had, according to this list?
Sorry, it was some interruption of connection. Can you repeat again?
Let's try again.
Yeah.
You say your list of emergency supplies have been out for about a week. Have you received supplies according to this list during this week?
We received some supply from Syrian American Medical Association a week before this list appeared, but it was upon our discussion. So yes, it already arrived to Brovary Hospital and works for people. But now this measured and weighted list with everything cut and just minimal of it. It was just released a week ago. So until this time, it's a very short period. We just start discussion and preparation of it, because this list is minimal for one operating room team. So with our partners, we can find exact target hospital in a red and orange zone, and this exact hospital usually contain from 1 to 5 operation room teams. So it's really could be discussed with a partner how much of these units they can provide. If they provide 1 unit, it's okay. It will come to, for example, Zaporizhia hospital. If they can provide 10 units, then it will be distributed between some exact hospitals.
But you haven't had any concrete response to the list yet.
We have not received any concrete response yet, unfortunately. And I see that many continue traditional humanitarian chains.
Yes.
When they gather what they have and send usually to some central stock, and coming from inside of Ukraine, I speak with hospitals. They usually do not see this humanitarian aid. It's distributed equally somewhere, and on this brink of battles, it doesn't come.
No. Tell us something about the Russian war. You accuse Russia of war crimes.
Sure.
Do you think? Yeah. Do you believe that the hospitals and healthcare professionals have been targeted? Are they targets for the military attacks?
Yes, sure. For Revival Institute team with Ukrainian Medical Association conduct investigation on all information about war crimes against healthcare. We created a special list, and it's constantly updated, and we provided to Ukrainian government and to government of several European countries that plan to have war crime courts. And we want that all these crimes will be investigated and will have a legal process like Nuremberg, like Gaag, and so on. So we conduct this work, and we see that very often exactly hospitals are targeted. It's like Mariupol maternity hospital, which had signs so that it is a healthcare facility. It's all on all our maps, but it was precisely targeted. The same as many cases when ambulances were captured for false flag operations, when some soldiers of Russia, they try to come inside of this ambulance car to some inside of city or to very close to Ukrainian troops, and then just try to fire them with like a false flag operation. So it's unfortunately Putin and Russian army uses attacks of such infrastructure, of healthcare infrastructure, to destroy the will of Ukrainian people and to put pressure to President Zelensky. Because if anything holy exists, if many civilian people will die and children will attack, pregnant women will attack, then it will be harder to President Zelensky to stand strong and to insist on stopping the war in the territories of Ukraine, because Russian Federation tries to insist of giving away some of regions of Ukraine and to force that Ukrainian government needs to be to come away and to destroy the sovereignty of Ukraine. So unfortunately, healthcare professionals and their patients are become the targeted victims.
You sent us a list with war crimes, alleged war crimes, and you included many links, mostly to news articles. Are you also conducting your own investigation into all of these?
Yes, sure. We have different insiders in hospitals, and we investigated further. But this work is under investigation. We do not want to put exact people under attack, under some pressure. So we do not publish it openly. We use only in this open list that we provide to journalists by now. There is news agencies, and important there are some Telegram channels with raw material when some insider or some civilian films something on his camera, and then it's published directly to the Telegram channel, and it's direct evidences of anything. But we have some lower layers that will be published later, probably directly to some government bodies and some court organizations.
Do I understand you correctly? You do not have information or documentation, like, you know, photos and videos that you could share with us?
We are not ready to share more than in this list. Some work is conducted and it will be updated later, probably, but we need to consult with some lawyers, and we need to think about providing providing some like defense for these people.
You also have a list of war casualties. You know, hospitals shelled and destroyed, medical workers injured and killed, etc. Is that who's the source for this information?
It's gathered from open source, from government bodies, from different statements of ministers, of advisors of ministers. So we gather all the raw data on it, all the links, but on our stingmd.org.ua site we show the analytics of everything of it.
Yes. Will this list, I believe the last figures are from March 16th, which is 7 days ago. Will your figures be updated?
Yeah, sure. But we are not so big teams, so we plan to update everything weekly or 10 days, 10 days step by step. Sure.
Yes. Okay. Do you, and I understand you do have many first-hand sources to what's going on within the hospitals.
Sorry,
you do have many first-hand sources to what's going on.
Yeah.
What do they report from the hospitals of the situation? How do they describe the status and situation in the hospitals?
Ukrainian Medical Association conducted lots of congresses and distant courses and so on. So we have 30,000 alumni of our educational programs. And Revival Institute made lots of trainings and executive trainings and consulting projects for healthcare administrators in hospitals. So we really have a network in Ukrainian hospitals, and we discuss with them, have lots of insights on it. So the problem is that Ukraine has become a decentralized healthcare system where ministry is in the center. They try to get some information, but they do not have direct links. Hospitals are decentralized. So hospitals were not prepared to war. They did not bought any reserves and so on. So now they try to survive, and usually they do not have a good supply. This supply is provided by volunteers. I told that if some battlefield action or some shelling will appear, some hospitals have this stock less than for 1 day to supply this flood of patients. And the second problem we have in regions is with chronically ill patients, because many cities are like in half of in partial siege. Like in Kiev, we have all logistical chains destroyed, but of course we have much worse situations in Kharkiv, in Mariupol exactly, where they are just under siege. So and the main situation in other cities is close to it. Pharmacies are just out of stock. People can't buy anything in pharmacies, and government programs of providing some medications does not work enough. So chronically ill patients do not have medications. It's a huge problem. There were some, even with insulins, there were some problems, and further with some endocrinological diseases, still there are absence of some medications, and so on. When I fell ill with sore throat, I was prescribed antibiotic. In Kiev, it was possible to buy only veterinarian antibiotic. So volunteers were seeking for me and found only on second day found some exact antibiotic and half of the course. Then I need to find more. So it's a really terrible situation when volunteer hubs, volunteer groups work as people who find some small portions of medication somewhere and bring to exact people, but still many of them does not have such access. So we also created the same approach to this chronically ill. We created some lists for civilians under partial siege, for people moving, for like internally displaced people, and we also spread it and try to establish such humanitarian programs.
And if you do get more supplies, will you be able to distribute them in a country torn by war?
Sure, we have a full-time staff now. Our office is spread over the country, so we have project managers, and we have the coordinators, as I told, alumni from different medical facilities. So we are motivated to give the direct observation of the whole logistical chain and to build a list of exact patients who will receive, or exact hospitals who will have this in their stock and provide directly to those of need.
Okay, good. So your main problem would be getting medical supplies. How do you think all this will, what do you think will happen within the next week or two, for this situation? How do you think the war and the situation for doctors and hospitals will evolve? What will happen?
I directly observe the military situation, and I see that Russian troops can't take more regions. They just stand and fight on the steel. So unfortunately, it's a worsened situation for healthcare facilities, because still we can't build a stable logistical chains. Still, economy does not work, and we can't generate more funds for further periods. So, so really, we everything that changed just 3 days ago. The government put an order that some planned surgeries can be accepted again. So, because before all hospitals were prepared for military action and they just waited for wounded people. Now we try to start all planned surgeries and treatment, but again we have hands and brains of healthcare professionals, but they can't provide treatment without some medications and all those medical supplies, and they cannot arise just from Ukrainian ground. We need to get it from somewhere.
Yes.
So probably we need to build the long logistical chains from world to exact hospitals where it is needed.
Is the Ukrainian Medical Association, is it a member organization? Do you have individual members?
We worked as organization that provides some educational opportunities, and we did not made a fixed membership because Ukrainian doctors are too poor and they are not ready to pay any membership fees. So we worked on the donations of some rich doctors who wanted to support, and from industry that wanted to be active and to support some medical education and some prosperity of medical profession, and for fees, for entrance fees to some courses and so on. And Revival Institute also worked with some consulted projects, so we accept fees from hospitals asking us to make some trainings or to make some intervention, like change management intervention in infection control, in processes, in some operational management inside hospitals. So all this funding is based on some donors who have some objectives to reach.
Okay. Would you have any idea how many hospitals there are in Ukraine?
There are around more than 1,000 of hospitals.
More than 1,000.
Yeah. But speaking about these frontline hospitals, it's around tens of them. So not so much. It's around 20, 30 of hospitals that need urgently this support. So really, it's very targeted initiative, and it could be reached very quickly.
Yes.
But unfortunately, if a war does not stop in a week or a month, then it's a matter of long logistical chains. It's like Third World War conducted inside Ukraine now.
Yes. Okay. Thank you. Anything else you would like to add? Anything we haven't covered?
I would like to ask you to publish the link on our StingMD petition, because from it starts the long collaboration of building these ties between Western democracies and Ukrainian hospitals having these outstanding challenges. So we ask to sign this petition to all people, then we appeal with some ideas how to spread it inside some medical and research communities, and then how to support hospitals with some humanitarian aid, or to provide some doctor volunteers to these hospitals, or to accept some patients, because even if international clinic does not want to spend anything or goes to Ukraine, they can be our rear back and to accept some patients inside Norway, for example, for some plastic surgery, neurosurgery, cardiac surgery, something that we need to restore for these wounded victims.
Do you believe Ukraine will win the war?
Of course, all Ukrainians are very active and enthusiastic. We will win this war with support or without it. So this is really the exam for Western democracies, whether they really can change something or they just can provide words and nothing more. So Ukraine now in the position of Czechoslovakia in the Second World War, when it was all the stakes, all the bets were made that Czechoslovakia would be the victim of Nazis and fall in a days. But Ukraine does not want to fall, and it will continue to fight for months and will continue further.
Thank you so much. Can I need a picture of you.
Sure.
Could you send it to me by email?
Picture, some photo of me, of course.
Yes.
Okay.
Yes.
Okay. Yeah. Sure. Yeah.
I'll send you an email, and if I have some follow-ups or if anything unclear, I will get back to you.
Thank you very much. Yes, and please send if you will publish something. It's important to share with doctors of Ukraine.
Thank you so much. I will send you a link. Thank you.
Thank you.
Good
Yeah.
luck.
Goodbye. Goodbye.
Bye-bye.